before it became de rigueur, who were doing exceptionally well, disease-free, having been stage 4 for 5 years, one of them was 20 years, and they relapsed. And I'm used to looking at this sort of thing. It's usually excess stress in one's life for several months. There was none of that. And the only thing, doing a borrow on it, was there anything they'd all had just before the diagnosis? They'd all had an unnecessary booster. And going back to the myeloma, I then had friends, and you mentioned the right scenario, who only had, I told them I didn't think it was wise to have the booster. They only had it, and 2 of them only had it so they could travel for their wives.
And that's what we did, exactly what we did.
Exactly. Now, in both these cases, the people felt awful after having it, and they ended up being very, very unwell. And I insisted they got scanned, and they had bone metastasis, one of them from myeloma. And then I found, asking questions, not at work, but amongst my contacts and everybody, I found 8 cases of people who'd had lymphoma or leukemia after the booster. And remember what I said about the booster causes this unnecessary immune suppression of the T-cell response. Well, why would you do that? Now, I must say, I'm furious with the MHRA, NHS Witty, and all this stuff and the other, because this is screaming. And all I was told to do was shut up. I would upset the patients. But when all around the world, my colleagues seeing exactly the same thing, and they were also told the same thing, to shut up and be quiet. This is, I was carpeted for breaking NHS guidelines. And I said, sorry, the NHS guidelines are completely wrong. I'm a doctor. My first allegiance is to first do no harm.
Exactly.
And I see harm being done by the booster. And as a lifelong scientist, clinical scientist who's been working in developing vaccines for HIV and cancer for years, I know the reason. We have an old adage in our work, as it was, any vaccine that needs a booster doesn't work, certainly for infectious disease. And I think that this proves the case very much here.